Good morning. My name is Arthur Gianelli. I'm the president and CEO of the NUHEALTH'S system. The NUHEALTH'S system runs the Nassau University Medical Center, the A. Holly Patterson Extended Care Facility, 4 community health centers, 4 family health centers, and 1 school-based clinic. We're here today, and I'm joined by a number of colleagues, board members, and community leaders and elected officials. We're here today to announce the issuance of a series of requests for proposals for the redevelopment of the 2 campuses that the NUHEALTH'S system owns, the campus in East Meadow and the campus in Uniondale. And if I could take a step back, we are in very challenging times. The economy is very challenging, and healthcare is very challenging. Hold on one second. Come on up. We are in very challenging times. Healthcare is very challenging. The economy is very challenging. That creates for us very, very difficult issues that we have to work through, and we have to think about how we, as the NUHEALTH'S system, transform ourselves from a safety net facility to a facility that is vibrant and that thrives post-healthcare reform. We need to figure out how we, as a system, can support even more than we do currently, the local economy. We think through this redevelopment proposal, we do both. All right, we take assets that have been underperforming or not performing for years, and we're going to convert them into performing assets. And as Mr. Maragos knows, that's rule number 1. If you're going to be a smart business person, that's rule number 1 in terms of how you do things. You look at what assets you have, how they're performing, and how you can make them and how you can optimize their performance. That's exactly what we're doing here with our real estate. A while ago, we identified the development concept for our real estate, the 2 villages, all right? The senior village at Patterson, which is going to be our Uniondale development, and our village for healthy living here in East Meadow. So it'll be a senior development in Uniondale. It'll be a healthy living and wellness development here surrounding the Nassau University Medical Center. And some time ago, we brought on a development partner, Healthcare REIT, which is the 2nd largest holder of healthcare assets anywhere in the United States of America. All right, so we brought on a major development partner with significant liquidity in order to be able to support our efforts to redevelop our campus. Now, we're spending a significant amount of money to modernize our current facilities, but we do not have the capital to modernize or to redevelop the entirety of our campuses, which in total is 85 acres of developable real estate on the 2 campuses. We don't have the equity to do that. We have the land. We need to bring partners to the table. We need to bring the private sector to the table to work with us in a joint venture capacity to redevelop these 2 campuses. All right? We see this as a significant development in Nassau County. There are so very few tracts of open land available for redevelopment, and certainly there's almost no tracts available on this magnitude. These RFPs in Uniondale will be issued to find joint venture partners to bring to Uniondale affordable senior housing, assisted living, and about 100,000 square feet of office and retail space to support the village, the senior village at Patterson, to support the people that are living on that campus. We're going to look for all of the developers that we're going to bring in, all of our joint venture partners, to make contributions towards the creation of a community center and towards the creation of ball fields to help the community. Here in East Meadow, the requests for proposals that we're issuing are going to be to construct housing for our medical residents and our students, and to construct in a joint venture partnership an ambulatory surgery center. Later on, in subsequent iterations, we will be issuing RFPs for the development of a cancer center, the development of a wellness facility, and the development of structured parking here at East Meadow as well. In both campuses, we will be taking the lead in building our anchor development. We will build an ambulatory surgery center here in East Meadow, and we will build, underwritten by the state of New York, a new replacement nursing home to substitute for the A. Holly Patterson Extended Care Facility, which has served us so well but which is in a building whose time has long since gone. We will expect our developers to hit LEED standards, silver to be exact. We are looking for both the individual developments and for the campuses to be as supportive of the environment as we possibly can make them. And we see this development as contributing significantly to the local economy. Over the next 7 years, we anticipate that the overall development on both campuses will be in the neighborhood of $600 million. We anticipate about 800 new permanent positions will be created and about 1,000 construction jobs will be created. We have a record now of doing this. Our emergency room construction, which has been underway for several months, is contributing significantly to the local economy. We put a lot of people to work who weren't working previously. This is a tough time economically, and our expectation is this development, this redevelopment plan, will help to put our men and women to work in a way that maybe others, that is sorely needed here in Nassau County. I see this redevelopment effort as being critical to the success of the new health system going forward. You have to take assets that don't perform and you have to make them perform. And you want to use your assets in a way that strengthens the overall corporate enterprise. By creating a senior village at Patterson in Uniondale, we're creating a place for senior citizens to live as opposed to migrating off Long Island, and we want to be their provider of choice. Here in East Meadow, we want to create we want to create things that are otherwise not accessible to people in this immediate area, whether we're talking about ambulatory surgery, whether we're talking about cancer, or whether we're talking about orienting the hospital around wellness in a way that few hospitals are currently oriented, all right? And creating a campus environment which would draw and attract people to this hospital in a way that they weren't previously drawn and attracted. It changes the configuration, it changes the nature, it changes the way people look at what we do here in East Meadow and what we do in Uniondale. And I think all of that is critically important for our survival as health reform takes hold and as we move over the next several years. So we're very, very excited for this announcement. This is the next step in the process. There are going to be many other steps after this. We're going to identify developers. We're going to be negotiating with them, awarding RFPs, and eventually going to start seeing construction going on here. And I'll be looking forward to that day most especially. But right now, it's a good day because what we're saying to the development community, what we're saying to the residents of Nassau County is that we have a vision for these two campuses. The vision is an unrivaled vision. It's the right vision for what we do. It's the right vision to take the new health system well into the 21st century, and we're excited to be delivering it here today, and we're excited to initiate this process. Joining me are a number of people, and I'll ask any of them who want to say a few words to please feel free to do so. From our board of directors, we have Dr. Gersha and Dr. Frank Saracino. Immediately on my left, I have legislator Dave Denenberg. Immediately on my right, I have Danny Godotsky from the Building Trades Council. I have Cheryl Petrie from the town of Hempstead. I have Controller Maragos. I have Legislator Abrahams as well. I should turn to the elected officials first and ask if any of you want to say a few words.